Hello friends, welcome to my channel Clinical Biochemistry by Dr. P.K. Prabhakar. Today we are going to talk about another topic of cancers, and we are going to talk about tumor marker. Uh, we have already talked about basics of chemistry. We have talked about characteristic of cancer cells. We have talked about etiology of cancers. We have already finished molecular biology of cancers, where we have talked about oncogenes and tumor suppressor genes. Today we are going to talk about tumor markers, their use, their significance, their drawbacks, what are the different types of tumor markers we are having, and we are going to how we are going to classify it. So we will see details about tumor markers, and then further we are going to later on we will talk about another video. We will talk about cancer therapy and cancer vaccine development strategy. As till now we don't have any vaccines, so we will talk about more about different strategy for the vaccine development. So first we should understand what is tumor markers. Tumor markers are also called as biomarkers, and these tumor markers, as its name suggests, it is marker. It is used for the identification, detections, for screening. So these are the different. So that's why it is called as markers, and it is related to tumor. So it is called as tumor markers, which can be used, which can be produced by tumor cells or the surrounding cells or the nearby cells, and which will help us for the detection of tumors. So tumor markers are found in higher than the normal levels in the different body fluids like blood, urine. It can be present in blood, it can be present in urine, it can be present in different other body fluids like cerebrospinal fluids, different other things, or it will be present on tissue of some of the people with the cancers. A tumor markers is anything which is present in inside the cells, or it will be produced by the cancer cells or other neighboring cells of the body in a response to cancers. So every time it is not necessary that tumor markers are going to be produced by tumor cells only. It can be produced by either tumor cells or by the surrounding cells in the response of cancers. So or in cancer conditions, benign condition, or in case of malignancy conditions. These tumor markers normally going to give us two important information. We are going to get it first, how aggressive tumor is going to grow, and how it is going to develop. It is going to growing, it will be increasing. And second one is how it is going to respond to the treatments. So actually if you see the tumor markers are the substance. It most of the cases it will be proteins that are produced by the cancer tissue itself, or sometimes by the body, other cells, nearby cells, neighboring cells, in response to cancer growth. Because some of these substances can be detected in body samples, like we have already seen blood, urine, body fluids, tissue, cells, inside the cells, on the cells. So these markers may be used for different purposes, like it can be used for the detections, predictions, for seeing the how treatment person is going to respond to the treatments, how treatment works or not works. Cancer can be reoccur or reoccurrence of the cancers. So different kind of information we are going to get from the tumor markers. We should understand what is some of the history of the tumor markers. Roughly 2000 years ago, the first known attempt to find tumor markers for malignancy was made, and it is described as in Egyptian papyrus, where breast cancer was distinguished from the mastatitis. Then around in 1950s, in 1846, sorry, not 1950s, it is 1850s. In 1846, first tumor marker in the modern medicine was identified by Bean-Jones, and in the form of Bean-Jones proteins, who detected heat precipitation in sample of acidified urine from the patient suffering from mollitus osseum, and this tumor marker was called as Bean-Jones proteins. So the first tumor marker which was detected, which was identified, was Bean-Jones proteins. That was in 1850s. Then in 1965, Gold et al. Isolated a glycoprotein molecule from the specimen of human colonic cancers, and is the first tumor antigens. Later it was identified as detected as it will be understood as it is carcinoembryonic antigens, CEA. Then the first modern tumor markers used for the detection of cancer was HCG, human chorionic gonadotropin hormone, the substance doctors looks for the pregnancy tests normally. A high level of HCG in the blood may be a sign of cancers of the placenta called gestational trophoblastic disease (GTD). Normally, whenever pregnancy will be there, that during pregnancy, HCG is a hormone which is produced by the placenta and which helps in the implantation of the zygote in the um, mother's womb. So normally human chorionic gonadal HCG productions occurs increases during the pregnancy. That's why it is used during the pregnancy test. But if its level will be very high, it is a sign of gestational trophoblastic disease. So because we are going to use tumor markers for different purposes, so we should understand what can be the an ideal tumors or what can be the different characteristic feature for an ideal tumor markers. First, it should be very specific. It should be highly specific. Means it can be detectable only in one type of tumors. Means an ideal tumors give you information. Tumor markers should give you information about a specific tumors. So for every specific tumors should have a specific tumor markers. It should be highly sensitive, means non-detectable in physiological or benign disease states. So it should be highly sensitive, highly specific, long lead time, sufficient time for the alteration of natural course of disease. It should be level correlated with the tumors, like it should be used for prognostic purposes and predictive utility in case of burden of tumor markers. It should have short half-life, frequent serial monitoring of the tumor markers within 5 to 6 half-lives. Simple and cheap tests should be there so that it can be affordable for every people for screening purposes, and easily obtainable specimens, so that it should be taken, it should be withdrawal, sample will be taken, sample will be withdrawn easy way from the persons. So these are the different characteristic features which an ideal tumor marker should have, but it is not necessarily not possible that every characteristic feature will be present in every tumor marker. So we are going to see as much as characteristic features should be present in the tumor markers, so that will be that much good tumor markers. Now, these tumor markers can be classified in different ways. So, tumor markers are going to be classified into two specific category, that is called as tumor specific markers and tumor associated markers. Tumor specific markers are specific for a single type of tumors, which I have told you is highly specific. Means tumor specific markers will be produced by a individual tumors. Means every tumor will have a specific markers, and that is called as tumor specific markers. Whereas tumor associated markers can be produced by many different type of tumors. So one tumor marker which is produced by many different type of tumors are called as tumor associated markers. When any tumor marker is going to be produced or related to only one type of tumors are called as tumor specific markers. Another type of classification for tumor markers are like it is called as circulating tumor markers or tumor tissue markers. Circulating tumor markers can be found in different body fluids, liquids, body samples. Like it can be present in blood, it can be present in urine, it can be present in stool, it can be present in other body fluids like CSF, uh, pancreas means it can be produced in gastric juice. It can be produced. It can be present in peritoneal fluids. It can be present in like parietal fluids. So different body fluids it will be there. Tumor tissue markers are found in the actual tumor inside. So it will be present along with the tumor, not secreted in the body fluids. These circulating tumor markers normally helps us in the estimation of prognostic. So it is having circulating tumor markers have a prognostic significance. It can be used for prognosis. It detects cancer that remains after treatment or that has returned after treatment. It is going to help us in the access of response to the treatment. It also helps us in monitoring of the cancers which is going to be resistant for the treatments. Whereas tumor tissue markers used for diagnosis, for the stage detection of the tumors, in which stage it is, or the classification of the cancer. It also helps us in the estimation of prognostic purposes and for the selection of a specific type of treatments. So both type of tumor markers, either it will be circulating or it will be tissue tumor markers, have different usage. It will be used for different purposes. Here is the list of all the tumor markers. Roughly, these are the different tumor markers. So, it is not possible that we are going to read every tumor markers in the details here. We can have some of the tumor markers. So, we are going to classify tumor markers on different basis. So we have already seen two types of classification schemes. Third classification scheme, which we are going to see for the circulating tumor marker, that is on the basis of their functional and biochemical characteristic features. So on the basis of functional and biochemical characteristic feature of the tumor markers, we can classify into tumor antigens, enzymes, hormones, oncogene or gene products, and some of the miscellaneous. So one by one, we are going to see what are these tumor markers, what tumor antigens, what are those enzymes, what are those hormones, oncogenes, and oncoproteins. So first, one by one, tumor antigens. These tumor antigens are going to be classified into three different classes, three different types. First one is oncofetal. Here we are having two examples, that is CEA, carcinoembryonic antigens, and alpha fetoproteins. Normally, these, as its name suggests, these are produced by embryonic stages. So, first one is CEA, carcinoembryonic antigens. So normally it is produced, it is associated with colorectal cancers, pancreatic cancer, breast, lung cancer, and gastric cancers. Whereas alpha fetoprotein, which is also produced normally in the gestation periods during the pregnancy, but it is responsible, it is going to give us information about hepatocellular carcinoma and germ cell tumors. These CEA are normally samples which we are going to take for CEA evaluations, that is blood, whereas sample taken for alpha fetoproteins, that is also blood only. So CEA help us in the staging of the cancer, determinations, prognosis, monitoring of the treatments, whereas uh, alpha fetoproteins normally help us in the diagnosis and monitoring of the treatments. Second class is polyclonal antibody. Polyclonal means, as normally we know polyclonal and monoclonal when we are having only one type of binding capacity, that is called as monoclonal. When it will have different type of antibody, different antibody will have different binding sites. Yeah, different type of antibody have different antigenic sites, that is called as polyclonal. So these two are prostate specific antigens, which is also known as PSA, and tissue polypeptide antigens, that is called as TPA. These two are polyclonal antibodies. So prostate specific antigen PSA normally increases in case of prostatic cancers, whereas tissue polypeptide antigens TPA normally increases breast cancer and gynecological cancers. And third class of this one we are having monoclonal antibody, which is CA153. So CA means it is called as cancer antigens or carbohydratic antigens, carcinogenic antigens, cancer antigens. Here, cancer antigens 15-3, that is normally gives us information, it is increases in case of breast cancer. So 15-3 is a specific for breast cancers, and the sample we are going to take for the detection of 15-3 is blood. Similarly, CA19-9, that is specific for colon cancer and pancreatic cancers, mainly colon cancer and pancreatic cancer, but it is also going to be associated with biliary cancer and gastric cancer, but colorectal and pancreatic cancers mainly. And here also we are going to take the sample, that is blood only. Third one is CA50, that is all related to colorectal cancer, pancreatic cancer, and gastric cancers. And here also we are going to take blood sample. CA125, that is related, 125 is related to cancer antigen, 125 is related to ovarian cancer specific, it is for ovary. And here also we are going to take blood sample. All these different cancer antigens 15-3, 19-9, 50, 125 or CA27-29, which is for breast cancers, these are normally helps us in the diagnosis, monitoring the treatment, and the reoccurrence of the cancers. So these monoclonal antibody gives us three important informations. for the diagnosis of the cancer, for the monitoring of the cancer treatments, and cancer is going to reoccur or not reoccur. So these information we are going to get it. Second category is hormones. So there are a number of hormones which helps us, which works as the tumor markers. Like we are having beta HCG. This beta HCG, I have already told you, it is produced by placenta during the pregnancy. It helps us in the implantation of the fetus, but it is going to be increases in case of chorionocarcinoma specifically. Other than this one, it is also increases in case of germ cell tumors of testis, ovary, gestational trophoblastic tumors. So it is mainly chorionocarcinoma. In this case, if we want to detect beta HCG, so it is normally produced, releases into the urine. So either you can go for blood sample or you can go for urine sample. So it can be detected in both the blood and urine sample. Gastrin, which is normally produced by gastric cells. So gastrin also uh, help works as a tumor markers, and it is going to associated with the islet cell tumor, specifically gastrinoma. So G cell hyperplasia, gastric produced tumor, that is gastrinoma, and in this case we are going to take blood sample. So this is present in the blood. Insulin, which is a normal metabolic anabolic hormones, which is produced by pancreatic beta cells, which normally regulates our carbohydrate levels, and it decreases, suppresses carbohydrate level. So insulin increases in case of insulinoma. So it gives us information that in islet cell tumors, that is called as insulinoma. So it is also works as tumor markers. Then we are having thyroglobulins, which is normally produced by thyroid glands. So this is a protein produced in the thyroid follicular cells. It helps us in the, it increases in case of thyroid cancers. So here also we can take two different type of samples. Either it will be detected from the blood sample or it can be detected from the tissue sample, thyroid tissue sample. So here the sample we will be collected, that is blood or tissue. Calcitonin. Calcitonin is a hormone normally produced, normally going to regulate calcium level. So this is produced by cancer cells. It is going to be increased in case of medullary carcinoma of the thyroids. ACTH, which helps us in the detection of lung cancers. Serotonin helps us in the detection of carcinoid tumors. And catecholamines, which is two types, normal epinephrine and norepinephrines. This is going to give us information about pheochromocytoma, that is cancer of adrenal glands. So these are different hormones which works for the different kind of tumor markers. So there are a number of MCQs comes on this human hormone tumor markers. So you should remember all these tumor markers especially. Then we are having a number of enzymes. So these enzymes also work as a tumor markers, like prostatic acid phosphatase, that is called as PAP. This prostatic acid phosphatase, it is normally increases by prostatic increase in case of prostatic cancers. LDH, we are having different type of LDH isoenzymes. So LDH1 isoenzymes increases in case of testicular or the germ cell tumors, whereas LDH4 or 5 normally increases in case of hepatocellular carcinoma, liver cancers. Similarly, alkaline phosphatase also we are having two specific isoenzymes. Alkaline phosphatase, which is for liver isoenzyme, that is increases in case of liver metastasis, whereas alkaline phosphatase bone isoenzymes normally increases in case of bone cancers. Next is neuron specific enolase, NSE, that is normally increases in case of carcinoids or neuroendocrine tumors mainly. Other than this one, there are some oncogenic products like ERB-B2, that is increases in case of breast cancer, ovarian cancers, or gastric cancers, and HER2 gene, that is very very specific for the breast cancers. Other than this one, these different components, different hormone enzymes, proteins, or antigenic components, oncogenes, there are a number of other gene products like JAK2 mutations. JAK2 mutations. This is specific for leukemia, and in this case we are going to collect blood sample or the bone marrow samples. Similarly, we are having KRAS mutations. KRAS mutations. This is specific for colon cancers or the lung cancer. Here we are going to collect tissue samples. Then we are having fibrin or fibrinogens that can be used as a tumor markers, which is where urine sample will be collected, and fibrin and fibrinogens is specific for bladder cancers. Then we are having EGFR, endothelial growth factor receptor, EGFR, that is specific for non-small cell lung cancer, and there we are going to collect tissue samples. Then we are having chromogranin A, CGA, that is specific for carcinoid tumors. So we have many number of tumor markers which can be used for detection of different specific tumors, which helps. So, what are the different tumor markers we are having? We can not only detect tumors, we have different usage. Like it can be used for screening, because most of the tumors markers are not sensitive or specific enough. So these tests are not very well suited for screening of general populations. However, a few may be used for screening people who are at the very high risk. So these tumor markers can give us basic information about the detection of cancer. So we can screen especially for those people who is at very high risk. Then it also helps us in the monitoring of different treatment, monitoring success of the treatments and detection of the reoccurrence. So tumor markers can be used to monitor the effectiveness of the treatment, especially in advanced cancers. If the marker level drops, the treatment is working. And if it stays elevated, it means there will be modification in the dose, modification in the medicines to be needed. One of the most important use of tumor markers along with guiding treatment is to monitor the cancer reoccurrence. If the tumor marker is elevated before treatment, low after treatments, or then begins to rise over time, then it is likely that the cancer is returning. So it helps us for those things also. It helps us in the diagnosis of the cancers. Like in the person who has symptoms, tumor markers may be used for the detection, helps in the detection for the presence of cancer, and help differentiate it from the other conditions with similar symptoms. So we can differentiate the person who is having cancer or who is not having cancer along with the same symptoms. Confirmation of the diagnosis, that also can be done with the tumor markers. Staging can be done, like we can detect, we can for the depending on the level of or amount of tumor markers, we can decide the in cancer is in which stage. Then it is also helps in the prognostic purposes, prognosis. Other than this one, like staging, I have told you, if a person doesn't have cancer, tumor marker elevations can be used to help determine whether the cancer has spreaded metastasis conditions, or or it will be in at the localized at that place only. In case of prognosis, some tumor markers can be used to help determining how aggressively cancer is likely to be. Means cancer is aggressive, cancer is in the soft mode, cancer is not going to be aggressive, cancer is going to be spreaded. So those things can be detected. Then tumor markers also guide for the choice of treatments. A few tumor markers provide information about the treatment might be effective against a person's cancers. This is a growing area of research, so we can select that one also. How these tumor marker test can be done? There are three different ways doctor can test for a tumor markers. Like it can be a blood test, it can be a urine test, it can be a biopsy test. In case of blood test and urine test, person or the lab technician people will collect blood sample and urine samples, and then that sample will be tested in the laboratory for purposes. In case of biopsy, a doctor will remove a small amount of tissue that will be examined by pathological under a microscopes. A patient needs to repeat tumor marker test because tumor marker level can change over time. So marker is not which once increases, it does not always increases, it will be remains increased, or if it decreases, it does not always remains in the lower condition. So its level varies time to time. So the test needs to be repeated after some time. There are some, while tumor markers test provides very useful information, it gives us many other insight about the cancers, staging, diagnosis, detection, prognosis, for the treatment, for the recurrence, number of useful things where they are having, but there are certain limitations also. Like the first limitation is many tumor markers may also be elevated in a person with condition or disease other than cancers. There are a number of tumor markers which increase, but they are not be cancers. So it gives us a positive test, but it is a false positive. So it calls as false positive. Means the test is positive, but without any cancer. In other diseases, the tumor marker level rises. Similarly, some tumor markers are specific for a particular type of cancer, while others are seen in several different type of cancers. Not every person with a particular type of cancers will have elevated level of corresponding tumor markers. So here we have uh, false negative, means cancer is there but tumor marker level does not rise. So here it is false negative, here it is false positive. And not every cancer have a tumor marker that has been identified or as associated with it. So every cancer does not have tumor markers, and in every cases similar type of response will not be there. Means in same person, two different persons will have same kind of cancer, but their tumor marker level will be different. So tumor marker is not very specific. Whenever tumor marker a person or a lab technicians or lab persons is going to seen in elevated conditions, it should be confirmed by a other corresponding secondary test like biopsy or some other test. So tumor marker alone is not a confirmatory test that that person is having cancers. So this is all about the tumor markers. Hope you have liked the video. If you have not subscribed my channel, please subscribe it. You can follow my channel on different social networking sites, social platforms. Thank you very much. If you have any query, any comments, you can write in the comment box. Thank you very much. Have a nice day.